Greetings to all who accompany us. Thanks to the organizers for the opportunity to contribute to this important conference. I will talk about challenges of professional training in traditional medicine, ethnomedicine, and natural therapies in Brazil. My name is Marilene Nascimento. I am from University Federal Fluminense in Rio de Janeiro. The Brazilian National Health System is called SUS. It articulates private and public institutions in the provision of public health services, and it's guaranteed by the Brazilian Federal Constitution of 1988. It's a universal system financed with citizen taxes and serves more than 2,010 million people. About 80% of them depend on it for access to health services. Some doctrinal and organizational principles of SUS are universality, equity, integrality, and citizen participation. It's an important democratic achievement in Brazil that is under risk in the current aggressive neoliberal government. In 2006, the Brazilian Ministry of Health enacted the National Policy of Integrative and Complementary Practices in Health. Its policy regulates 29 traditional and natural care modalities in the SUS, and this offer is growing 78% concentrated in primary health care. Principally, the practices, medicinal plants, phytotherapy, auriculotherapy, body practices, acupuncture, integrative community therapy, art therapy, and homeopathy. It's important to highlight that the Brazilian ethnomedicine from indigenous and Afro descendants is not covered in this national policy. The legislation of the 29 practices in the SUS took place at different times. In 2006, it was regulated traditional Chinese medicine, homeopathy, anthroposophic medicine, phytotherapy, and thermal therapy. In 2017, Ayurveda and yoga, naturopathy, art therapy, dance therapy, integrative community therapy, meditation, music therapy, chiropractic, and osteopathy, reflexology, Reiki, Shantala. In 2018, apitherapy, aromatherapy, ozone therapy, flower therapy, gel therapy, bioenergetic, chronotherapy, familiar constellation, hypnotherapy, and laying of hands. With national policy, there was a growing interest from health professionals and SUS users in the traditional medicines and natural therapies. Despite that, there is a restricted presence of these practices in health professional training curricula in Brazil. These practices are present in only 21% of medical schools, for example, with emphasis on acupuncture and homeopathy. Because that new health professionals arrive at SUS knowing little or nothing about natural and traditional medicines and therapy. What produces prejudices due to ignorance, resistances, and limitation on supply of these practices in the SUS. But if the teaching of traditional medicines in natural therapies is not, or it's not enough in the curricula of health professionals, they are growing in the free courses offered in the private health market. These free courses are authorized but not regulated by the Ministry of Education. The regulated training basically includes technical, undergraduate, and graduate courses. Free courses are not regulated or even evaluated by the Ministry of Education, and any institution can offer them on the market. And there are a wide range of formats, workload, and quality levels among these courses. Furthermore, there is no definition in Brazil of minimum quality criteria for training in these practices, what reinforced criticisms regarding the quality, safety, and effectiveness of traditional medicines and natural therapies in the country. In 2019, Brazilian Association of Collective Health Working Group and other institutions linked to the traditional medicines and natural therapies invited to a public debate on minimum quality criteria for professional training. One result of this debate is the proposal of a research project called the Brazilian Study on the offer of training courses in integrative and complementary health practices, the former PICS Brazil. This study has as objectives to analyze the profile of the offer of professional training courses in integrative and complementary practices in health and its compliance with guidelines and recommendations of regulatory institutions. This research, former PICS Brazil, is a multi-center study developed in 11 cities in the 5 administrative regions of the country. It uses mixed method with exploratory document analysis of primary sources of public access on internet. And it's organized in 3 phases. The first one, we look for profile of the courses in the Google platform, in the public university websites, and in the health department's websites. And the record of the data was made at Redicat. The phase 2, we looked for guidelines and recommendations for training in the websites of the World Health Organization, of the Brazilian Ministries of Health and Education, the Brazilian Federal Health Councils, and in websites of national and international professional associations. And in the phase 3, we looked for a correlation between course profile and regulatory institutions' guidelines. In the first stage of this research, we focus on homeopathy, integrative community therapy, yoga, and Reiki. We are aware that the absence of information on the website is different from the absence of an approach of the topic in the institution. It reveals, however, greater or lesser appreciation of specific information. I now present the initial results of the research with data from courses offered in the city of Rio de Janeiro. Homeopathy is defined in the Brazilian thematic glossary of the Ministry of Health as a therapeutic approach of a holistic and vitalist nature that sees the person as a whole, not in parts, and whose therapeutic method involves 3 fundamental principles: the law of similars, experimentation on healthy people, and the use of ultra-dilution of medicines. In the left column of this picture, you can see some research variables the quantity of the courses and the institutions' regulations, the prerequisites, the workload, basic contents, modality of offer, if face-to-face or online, information about practice and professional internship, and references to SUS and the national policy of traditional medicines and natural therapies. In the middle column, we have information about the courses offered in the city of Rio de Janeiro. And in the right column, we have reference institutions for the regulation of professional training, mainly national and international associations of each practice under study, health organization as World Health and Brazilian Health Ministry, and Brazilian Professional Health Councils. We identified 9 homeopathy courses in Rio de Janeiro and 23 reference institutions for professional training, 5 of them international ones. In Brazil, homeopathy is mainly offered for higher-level professionals in medicine, pharmacy, and dentistry. That's why most courses require higher education as a prerequisite for training. We identified a significant variation of the workload of the courses offered and recommended, and the diversity of minimum contents depending on the student's basic profession. There is a balance between face-to-face and online courses, and no information about this item in the reference institute's websites. We find little information about professional practice and internship, both on the websites of the courses and of the reference institutions. And almost no reference to SUS and national policy in traditional medicines and natural practices. Some mention of the SUS was expected, at least in national institutions of reference for training in homeopathy. Now let's see some results about integrative community therapy, which is defined in the Brazilian thematic glossary as a collective therapeutic practice that involves community members in an activity of building solidarity social networks to promote life and mobilize the resources and skills of individuals, families, and communities. The integrative community therapy was created in Brazil in 1987, and it has a national association that coordinates professional training centers across the country, Abratecon. So Abratecon has a training center in Rio de Janeiro that offers one course of integrative community therapy in the city. Prerequisites of this course are a little lower than recommended. The course offers a higher hourly load than recommended. And there is compatibility in the basic contents, modalities of the offer, and presence of practice and professional internship. And we did not find any reference to the SUS and the national policy of natural practices. Let's now see the initial results of professional yoga training. Yoga is defined in the Brazilian thematic glossary as a body and mental practice of oriental origin, used as a technique to control body and mind associated with meditation. We found 29 courses, yoga courses in Rio de Janeiro, and 18 reference institutions, 6 of them international ones. Although there are variations in the recommendations here, the prerequisites are below what some reference institutions indicate. There is an important variation in workload, both between courses and between regulatory institutions. And we found a predominant offer of online courses and no information on this aspect in reference institutions. Professional practice and internship are valued on course websites and also on reference institutions. And here is also almost no reference to the SUS and the National Policy on Natural Therapies. We now move on to the initial results of Reiki training, the fourth and last analyzed practice in the research. Reiki is defined in the Brazilian thematic glossary as a therapeutic practice that uses the imposition of hands to channel vital energy, aiming to promote energy balance necessary for physical and mental well-being. Reiki is one of the vibrational healing practices that make up the framework of laying on of hands technique. Here. Yes, we found 53 free courses of Reiki in Rio de Janeiro and 70 reference institutions for the regulation of training, 7 of them international ones. Courses of Reiki are usually offered in 4 levels, and the most frequent prerequisites are the fulfillment of the previous level, but some institutions recommend up to 2 years to practice between levels. 2 years of practice between levels. In these cases, in Reiki, the prerequisites are below the recommended. There is a huge variation in the workload of the courses, and we didn't find recommendations on this item in the reference institutions. We found some variations in the basic contents. The offer is mainly face-to-face. And there is an important divergence between reference institutions on this aspect. Some of them are decisively against the offer of the online courses. The supervised practice were evaluated by the reference institutions, but it was rarely mentioned on the course websites. And the practice of Reiki in SUS is almost not mentioned in the websites. We now highlight some points for attention based on the results found. There is a predominant offer of free courses in the private marketing, but this modality of offer should not replace policies to encourage the inclusion of the topic in regular courses of professional training in health. There is a big discrepancy, especially in yoga and Reiki courses, although with compatible content topics. This discrepancy occurs between courses and recommendations from reference institutions. We found an important presence of online courses, which likely grew during the pandemic. There is an explicit opposition from some Reiki institutions to these courses. And in our understanding, it's a relevant question for health training, mainly in its practical components. The practice and the professional internship are little explained in the courses, more valued in the reference institutions. And the low mention of the SUS and the national policy is an important point of attention because the contexts of offers in the public services are different from the private ones and demand also different strategies. But the free private courses are usually not sensitive to the public health service needs. And to conclude my speech, it is important to highlight the multiplication of online courses with multiple peaks, little workload, and no practice internship. This first stage of the research focuses on specific courses of one modality of practice. The recent growth of courses with multiple practices should be subject of further studies. We had a great team in this research with participants from education and the health institutions in the 5 administrative country regions. The overall coordination is mine and Daniela D'Alegrave. The South coordination is by Inês Reis, Homeopathy by Xavier Gamarra and Karen Dinês, Integrative Community Therapy by Milene Zanoni, Yoga Coordination by João José and Lisandra Oliveira, and Reiki Coordination by Júlio Wong and Miriam Yamaguchi. I leave you my contact and my gratitude to the audience, and I make myself available to answer questions about the research. Thank you very much.